supposed to be preparing and giving them bed bath. We have so many purposes of giving this bed bath. Number one is to clean the body. Even if there is no any dirt, even the sweat that is coming out of your body is coming together with the waste product and it is considered as what? As a dirt. And there is need for it to be removed. And there is also need for refreshing the body. Sometimes there is no any dirt on your body, but you say, let me go and take a bath so that I can feel refreshed. So another purpose is for refreshing the body. Another one is to improve circulation. In bed bath we use warm water, and as you are massaging the body, you are improving circulation. If you are healthy and you are doing your activities, these activities now are stimulating your body. They are encouraging circulation. But for patients who are confined to bed, they don't carry out much activities. Therefore, they need something to stimulate their system and stimulate circulation. So whenever you are giving them bed bath, you are stimulating circulation. Another one is to promote self-image. The way you are appearing, that is your image. There is no difference between like maybe somebody who is an emir and somebody who is a madman. The only difference is the way they are appearing. So your appearance is promoting yourself. So another purpose is to clean the body and promote self-appearance. Another one is to teach them the principle of hygiene. Some they don't even know how to take care of their personal hygiene. But if you are giving them bed bath, on the course of giving them bed bath, you are teaching them the principle of personal hygiene. And another important one is to create rapport between you and the patient. They will feel highly honored that you are preparing and you are giving them bed bath. So there will be good relationship between you and them. So another purpose is to create this rapport between you and the patient. You can think of so many purposes, but basically these are the basic purposes of giving bed bath. So who are the indications? What type of people do you give bed bath? Unconscious, patients who are not conscious. They cannot take bath, you have to give them. Who again?
People that cannot move from the bed.
People
That cannot move from the bed.
that is critically ill.
Critically ill.
We call them critically ill patients. You have to give them bed bath because they are confined to bed. Who again?
Those are illiterate ones that
Illiterate.
have the knowledge of taking bath.
Illiteracy, this one is not an excuse. There is bed bath and there is assisted bath. If they are illiterate, they don't know the importance of taking bath. You can give them assisted bath. That one is to escort them to the bathroom and you show them how to take care of their body. That one is not bed bath. If they are fit to be out of bed, but they are illiterate, they don't know the importance of personal hygiene. So that one you take them to the bathroom and you give them assisted bath. That one is assisted bath, not bed bath. So who again?
What of that of paralysis patient?
That is very good. Paralyzed. Patients who are paralyzed, especially paralysis of the lower limb. You cannot take the patient to the bathroom with paralysis of lower limb. Some they have quadriplegia. That is upper limbs and lower limbs are all paralyzed. So they have to be giving them, that is another important type of fracture. Patient with multiple fracture. Sometimes even if it is single fracture, if the patient is on traction, you have to be giving him bed bath. Even if it is single fracture, but there is traction, you cannot be removing the traction whenever you are taking him to bed bath.
Okay.
To bathroom, I mean. So you have to be giving them bath while on bed because they are on traction. So patient with multiple fracture is another indication. These are some of the indications of patients who will give bed bath. Then we move to requirements. Bed bath is a trolley procedure. For trolley procedure, we have top shelf and we have the bottom shelf. So what we have on the top shelf, we have the jugs. 2 jugs. One is hot water, the other one is cold
water.
2 jugs. Jugs. These are what we call jugs. One is hot water The other one is
Cold water.
cold water. This one is what we call the mixing bowl.
Mixing.
Mixing bowl. That is in which you will be mixing the water.
Water. Okay.
You are going to mix the hot and mixing bowl.
Which one?
This one is mixing bowl. That is where you are going to mix your hot and cold water. This one we are improvising as what we
No
call
need.
bath thermometer.
Let me just hold it as if I want to write. So I will not
Yes.
know.
You're supposed to measure the temperature of the water. Bath thermometer. You know clinical thermometer,
Yes, sir.
but we used to take the temperature of the patient. So there is need for you to take the temperature of the water.
Okay.
After mixing the hot and cold water, you are going to take the temperature. So this one is bath thermometer that we are using to assess the temperature of the water. But this one is clinical thermometer. We are improvising. This one is a jog. Receiver, I mean.
Receiver.
Receiver with soft and 3 planets. These are what we call planets.
Planet.
Planet.
Okay.
F-L-A-N-N-E-L. Planet.
Planet.
We are improvising with this handkerchief. Is it clear? Planets are
Be
a
writing
little
the
bit
name.
bigger than this one. But we are improvising this one as planet.
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 F-A.
So that is a receiver with soap and 3 planets. These ones, they are just like the sponge, and this one is a soap.
Okay.
So you have your container with this. There is another receiver with Vaseline and powder. This one is the Vaseline or any foaming that is going to be applied, and this one is powder. This one is another receiver with comb, and this one we are improvising as nail scissors. That is nail cutter. This one we are improvising it as nail scissors. The one that we are going to use in cutting nails. So you have another receiver with comb and
No,
scissors. I think that is all on the top shelf.
Okay.
Then we have the bottom shelf. On the bottom shelf there is 2 towels, 2 bath towels. Sometimes we have additional one, that is face towel.
Test.
If you have, you can come with 3. 2 bath towels and 1 face towel. But if there is none, you can come with only 2 bath towels. Then there is hospitals in which they provide the patient with gown. They are using gown just like uniform. So then there should be patient's gown on the bottom shelf. Or if you are using the patient's clothes, if you are preparing the trolley, you go to the relatives and you collect clean gown that you are going to apply on the patient after giving bed rest. So that gown should be on the bottom shelf. Then there is a receiver for used water. Do you understand? This one is for mixing water.
Mixing water.
There is another receiver for used water. As you are giving bed bath, if the water becomes dirty, you discard inside that receiver and you mix that one. So there should be receiver for what? For used water. And here there should be clean bed cloths.
Clean.
Clean bed cloths. Bed linens.
Okay. Okay.
There should be what? Clean one on the bottom shelf. Why? Because on the course of giving bed bath, this one will become what? Wet.
Wait. Okay.
So after the bed bath, now you remove it and you apply the clean one. So you come here with like clean bed linen. Is it clear? Then by the side you can have a linen bee.
Leaning.
What will linen bee? Linen bee.
No.
Then to it. You will take it back. You don't sit on the desk. Good. This is what we call linen bee. This is what we call linen bin.
Bin.
Just like dustbin.
Okay, dustbin. Okay, a line.
Just like dustbin. This one is linen bin. If there is any soil linen that you are discard inside this. So that's what we call linen.
Bin. Okay.
Is it clear? So these are the requirements that we need for weight bus. Any question? Any question for any requirements? So Malam, you go to other side. So Malam will be my assistant. Now we are going to do the procedure. Weight bus is 2 nurses procedure basically.
Excuse sir.
Yes,
Temperature for the water.
it's 39 to 40.
39.
Yes, 39 to 40 degrees Celsius. This is the temperature.
What are the use of this?
You are going to see. I said they are like the sponge and soap. If you are taking bath, what is the use of sponge?
So easy to keep it. So
Sponge.
Sponge.
okay, sponge.
What do you use sponge for?
Advising for washing our body.
So that is this one they are serving like sponge and soap.
Okay, sir.
Sir, in relation to the bed lining, is it both the top and bottom that you drop in the lower and the lower trolley?
You are not dropping anything. It's only the ones that get wet or soil.
Oh, okay.
If they are clean and okay, you don't have to remove anything.
Oh,
This one you come with them in case.
okay.
As you are giving bed baths, some will become wet.
Okay.
Soil. So now you discard and you fruit new one.
All right.
But if you finish your bed bath, no any soil, no any wet, so you can leave them.
Oh, okay.
Is it clear?
Yes, sir.
Any other question? So before we start, if there is any extra, let me have it. What is the hospital you want to take you about?
Can you see?
Sasa ya mama. Lakini kuna